Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Welcome to today's episode of Hear From Her, a healthcare leadership series where we amplify and elevate the experiences and perspectives and insights of women leaders to advance women's health and gender equality. I am Sarah Thorpe, Director of Clinical Strategy at Medscape, and I'm thrilled to be your host for a powerful conversation on the intersection of leadership and advocacy in women's healthcare. Today, we're diving deep into what it means to drive change from boardrooms to communities with two exceptional leaders who bring bold perspectives, personal passion, and real-world action to the table. Our guests demonstrate the powerful intersection of innovation and advocacy, showing how private industry and public health leadership can drive change. Joining me are Drs. Stephanie Sober, Global Director of Medical Affairs for Women's Health at Perrigo. Welcome.
Thank you.
And Dr. Reagan McDonald Misley, CEO of Power to Decide. Welcome.
Thanks for having me.
Great. So to kick things off, I'd love to hear from both of you. What inspired you to pursue a leadership role in women's health? Dr. Sober?
So this question is interesting to me since for me, I didn't really set out with the goal in mind, of a leadership role per se. I knew that I wanted to do meaningful and impactful work. And I was lucky enough to find a company in HRA Pharma originally, now Perrigo, whose mission and goals were aligned with my own personal mission and goals, which were expanding access to contraception, both regular and emergency contraception. And then it was really the work itself that led me on this path to more of a leadership role.
Fantastic. And how about you, Dr. Reagan?
Yeah, I think much like Dr. Sober, I didn't sort of come into this saying like I want to be a leader, but I fell into it. And really, my first job out of fellowship was at a faculty member at an academic institution. And I found that some of the things that I wanted to do were harder to do from that perspective. I had a huge commitment to advocacy and wanted to use my voice to advocate for change at the policy level, and also wanted to really center people who face the most barriers to access. And again, I felt like the things that I wanted to do were more aligned with the work at the local Planned Parenthood, which had a leadership opening at the time, and they recruited me for it. And my initial reaction was like, no way, I'm fresh out of fellowship. I'm not ready to be leading a healthcare system with 7 health centers and, you know, 20 direct reports. um, but after a year of sort of contemplating this, I jumped at the opportunity, and it has been the absolute best thing for me. And, one of the things that were a real turning point for me was that at the very hyper local level in Baltimore City, there was a bill that was basically a truth in advertising bill for crisis pregnancy centers that asked them to just post a sign in their waiting room saying, we don't refer for abortion and we don't provide contraception. And I spoke at the City Hall hearing about this, and just told stories about my experience of meeting patients who'd sort of gotten caught up at crisis pregnancy centers and who were fed mis and disinformation and had trouble navigating care after that. And just from the storytelling at that City Hall meeting, in addition to many other advocates, the bill passed. And I was hooked, and this was very early on in my career, and really was committed to, again, using my voice to enact change for a broader swath of the population and really focusing on folks who face the most barriers. And I was able to do that more directly, serving as the medical director of Planned Parenthood of Maryland, where we expanded services, including adding gender affirming hormone therapy and PrEP care, and partnered with local and state health departments to increase access to contraception, both in Baltimore City and across the state. I also had the chance to advocate for advanced practice clinicians to be able to provide abortion care, which has had huge, meaningful implications across the state, as well as expanding contraceptive coverage through a statewide bill. So, yeah, I landed into this place, and I'm so happy that I have been able to, because I've been able to impact change at a much higher level. than had I not taken a leadership role.
So, thinking about these dynamic pathways that you both have taken and through your careers, how do you manage the demands of executive leadership, but also stay in tune to those voices that you just spoke about, staying connected with patient care and clinical work? How are you navigating those demands?
I think that for me, um, even though my more full-time gig is working with Perigo, I still do work clinically part-time for the Planned Parenthood affiliate in the Philadelphia area near where I live. And I think, for me, that's always been really important to still be a provider and to still be, working directly with patients one on one. But it's also, I think, really grounding in the sense that, it while you're trying to work at, a broader scale or in a broader scope in the other capacities, it really lets you, still be able to work one on one with people and try to care for people just, on that individual level as well.
So I think for me, it's really important that I'm just sort of grounded in my background and my family history. I came from a working class family. My mother was a teen mom. Lots of folks in my family have struggled to access quality, comprehensive reproductive health care and services, and so all of that is a part of who I am, right? And sort of why I um, started on this path to focus on this work. And that will always be a part of who I am and grounds me and sort of why I do this work. In addition, it is really important to me that I'm still able to provide patient care, even though it's not as much as it used to be. But having those interactions with folks on a monthly basis, that also grounds me and sort of the importance of our work and how transformative, comprehensive, compassionate, person centered care can truly be for someone. And those are the stories that I take with me too in my work back at Power to Decide every day.
So, thinking back to your younger years and looking back, if someone wants to become a CMO or a CEO someday, where should they start building their skills, their network? What advice do you have for those young professionals?
I've never been one of those people that had like a 5-year plan, like a concrete 5-year plan. And had I had one, I would have surpassed it a long time ago. And so honestly, like my modus operandi, my MO has just been to like show up, say yes to really fun, innovative projects and say yes to working with like really great people. And if I keep like just showing up, doing my best, and saying yes to impact and saying yes to working with really great people, that's taken me, far beyond my wildest dreams in terms of, leadership roles, leading teams, and doing really fun, innovative work. And that couldn't be more true than the work that we do at Power to Decide, where we're working often in the digital space, in this space where someone is just like at home on their computer or watching television or a movie or on social media and thinking about access to sexual and reproductive health, we're meeting them in that space, scrolling through their phone on television, etc., and meeting them with positive messages around sexual and reproductive health, which is critically important to then connect them to the information that they need to take the next steps in a reproductive health journey and ultimately, hopefully, connect with a provider who can get them what they need. So that has just been such an honor to lead the amazing team there and be doing this work through our platforms. I never thought when I started my career that I would be like a TikTok influencer, but on the other hand, it's such a powerful way to meet young people with reproductive health information in ways that didn't exist when I went to medical school. So I couldn't even have imagined this as a platform to reach people.
I think I had similar experiences to, Dr. Reagan in that, this wasn't my goal per se in terms of, having a leadership role. But, I am a big believer in sort of taking the journey that you need to take. And, I sort of switched paths early on in my career. I was not pre med as an undergrad and sort of made that decision to switch paths and, at a later time. And I think, it's just really important that people sort of listen to their gut and go with, what's important and meaningful to them. And I think that sort of allows you to go on that journey and have the experiences that ultimately allow you to do the work that you want to be doing. And, I feel very lucky in the sense, again, that I sort of fell into a position that, with HRA Pharma originally, that allowed me to really be involved in such meaningful projects. I think you need to allow life's experiences and the journey to happen and take you where they will. But I think, using your own personal goals and mission as the sort of guiding principle there.
And so, thinking about impact in the space of women's health, why it is so important for the voices of women to be at the table today, and how the voices of women like yourselves are really helping to innovate and shake things up in the space of women's health today.
I mean, I think it's so critically important that women are in leadership roles in healthcare and pharmaceutical innovation, in part because we have lived experiences, right? Like when I was 30 weeks pregnant doing my maternal fetal medicine rotation and taking care of high risk pregnancies that were also 30 weeks pregnant, I brought a different perspective of the realness of that to my work. Another example, I've tried almost every contraceptive method available, and I have that like lived experience that I bring to my work. I experienced breastfeeding as a working mom and how challenging that was. And so as women in leadership roles, we bring those lived experiences into problem solving and ideally envisioning a better world for the next generation of women leaders and for people assigned female at birth. For example, like providing more person centered contraceptive care, because we have been on the other side of that, improving maternity care and postpartum care, improving lactation support, et cetera. I think that is critically important to have the lived experience to bring those perspectives to leadership roles.
Yeah, I think Dr. Reagan said it really well. And I would have to agree, that even though it sounds simple, it's really the fact that we can bring our own lived experiences, as well as, for those of us who are also clinicians, having the lived experiences of our patients in our minds, even if we didn't go through those exact things ourselves, it's an incredibly helpful perspective to have. And I think that allows us to really have a better sense of determining whether or not those things would actually meet the need that, is exists, and whether something would really truly be an improvement over what either currently exists or is current practice.
I want to dig into this a little bit more in terms of, focusing the conversation on an area that you all are deeply committed to, which is person centered contraception access. So let's unpack that a little bit more. What do you see as the most pressing challenges today in the contraception landscape, especially when we consider reaching different populations and communities? Can you speak to that a little bit?
I think we can't talk about challenges to contraceptive access today without acknowledging that we're operating in an unprecedented times. And as you stated, like the impacts aren't unique to everyone, right? It's the folks who face the most barriers because of the overlapping systems of oppression that people who are people of color, people with lower incomes, younger people, people who live in rural areas are going to face the most challenges. And that has led to a situation where over 19 million US women today of reproductive age live in contraceptive deserts. And with these ongoing attacks, 2 to 4 years from now, that could be even greater. So the need to focus on person centered care and equity in contraceptive access couldn't be more important than it is today than ever before.
Yeah, I totally agree. And, we're only really seeing greater challenges to access to contraception today, as we see an increase in restrictions on sort of reproductive health more generally. So I think, all of these challenges are only going to increase, and become even more pressing and important to address.
Another challenge to mention that folks should be aware of is the propagation of mis and disinformation, specifically about contraception. Unfortunately, like we don't have comprehensive sex ed across the country. So many of us are operating already with like a low level of health literacy about contraception. What is fertilization? What is implantation? What are ovaries? What is ovulation? A lot of folks, never got that baseline understanding, right? And so then we often have a lot of myths surrounding contraception, around the safety of contraception, et cetera. So at Power to Decide, we launched the Your Health survey last year and found that nearly 1 in 5 people believe that they should take a break from birth control pills every few years because of their concerns that it wasn't safe. And many folks felt that menstrual tracking apps, 23% specifically, thought that they're a highly effective way to prevent pregnancy, which isn't true. And there was a lot of confusion between medication abortion, emergency contraception, and birth control. So there's a lot of work that we have to do to just overcome baseline misinformation, not to mention the deliberate propagation of disinformation. So much work to be done in this space of combating mis and disinformation, specifically around contraception.
Yeah, as we said, a lot of work to be done in this space. So, what strategies do you all see as effective in terms of truly moving the needle in this space to support equity centered efforts?
I can start. I mean, I think, certainly health equity is always top of mind and should be when, we're thinking about contraceptive access. And for me, that's true really whether I'm wearing my Perigo hat or my clinician hat. You know, we are always and again should be working toward increasing access for all. And so we've really seen how this change has broadened access for folks who may not have had access to the traditional healthcare system or who may not have insurance. But again, we know we can't get to everyone. And so, certainly to get to, true health equity, there really needs to be a multi-pronged approach here with different types of solutions at play. I think in order to truly achieve that goal or get closer to it.
Yeah, I think in order to center health equity and contraceptive access, we have to both recognize and address the overlapping systems of oppression that impact access. And we also have to realize that, like, where someone happens to live can also significantly impact their access to contraception. We have to really center person centered care and frameworks, particularly given the history of reproductive coercion in our communities. I have lived and practiced in Baltimore for almost 20 years now. And you can read about a contraceptive access project in Dr. Dorothy Roberts' book, Killing the Black Body, that happened here in Baltimore back in the late 1990s. That was, well meaning public health professionals trying to increase access to the contraceptive implant, particularly in low income communities. But the way it was implemented and received by the community, it felt like complete reproductive coercion and tending to limit the fertility of specifically poor Black women. And the legacy of that project is something that, like, as a family planning provider in Baltimore City for almost the last 20 years, that I've heard over and over and over again from members in the community, even if they can't speak specifically to the project, just the lasting impact of that on how they interact with the healthcare system, and their perception of contraception and the intent of contraception. So it's really, really important that we center person-centered frameworks and models from the very beginning. And then, of course, we have to do a lot more work to combat the spread of mis and disinformation. And that's why at Power to Decide, we're using our platforms to promote evidence-informed and accessible information about sexual and reproductive health topics.
And with innovation has to come unexpected roadblocks along the way, I'm sure. Can you speak to some of the challenges that you encountered, surprises along the way, and how you navigated those?
One of the most surprising challenges has been just how difficult it is to raise awareness. And I'm sort of constantly surprised by, how many people are still not aware that OPIL exists, even though at the time of the switch, we got a lot of national media attention, even. And so, to me, it's a bit surprising and shocking that in today's world that really, seems to be so connected, it actually takes a really considerable amount and a concerted effort to get the word out.
Yeah, there will always be challenges. I think just, taking a step back, the most surprising challenge I think is also an opportunity. in terms of just the spanning my whole career has really been the need to shift from a control and paternalistic perspective in the field to one of empowerment. So I spoke earlier about the long-lasting historical repercussions of reproductive and contraceptive coercion, and it's been really great to have sort of folks on the ground and reproductive justice leaders helping to shift the paradigm again from a more paternalistic perspective where the fertility of people seemed to be something that needed to be controlled to something that was much more of an empowerment frame. And how do we center people's reproductive well-being and ensure that they have the autonomy to choose whatever method is right for them, recognizing that often birth control is a journey, right? Like so many of us will try so many different methods throughout our lifetime, and like the one method that we're on at one point in our life might not be the right method for a different point in our life, right? And so that has been a challenge, a surprising challenge, but also a huge opportunity. And I think that we're in a much better place as a movement now. And I still think we have a long way to go. And so I'm hopeful that in even 10 years from now, we'll look back and say, wow, we have learned so many lessons. And we're providing much more person centered and community centered care in a way that meets people's needs in ways that we couldn't even have conceptualized 10 years ago.
Yeah, this seems to be such a critical piece of the puzzle, the engagement component. I'm curious, what are some innovative or unconventional ways in which you all are sparking awareness, building conversations around contraception access?
So this is a huge part of the work that we do at Power to Decide. Hopefully, you all are aware of our Thanks Birth Control campaign that we do every November, where we shout from the rooftops, literally, about the importance of contraception. And we have, policymakers from Hillary Clinton all the way down to everyday folks just talking about like what access to contraception has meant for their lives, their ability to manage their medical concerns, their ability to time and space their pregnancies, the ability to just like not have to deal with a period, all of the myriad of reasons that people use contraception. And it's really important that we're combating stigma around these issues so that access to contraception can just be normalized, a normal part of someone's journey in their life and a normal part of healthcare. Again, we created the hashtag Ask Dr. Reagan series across our bedsider social media channels to address the need of information around contraception, relationships, sexually transmitted infections, all the types of things that folks are looking for information about in an accessible and non-judgmental way. And we have Bedsider's Method Explorer that allows folks to explore various types of birth control methods, and a clinic finder that can connect them to the clinic nearest to them that provides the full scope of contraceptive care. So it's a huge part of what we do at Power to Decide. And we're so grateful to be able to do this work in a meaningful way in partnership with folks like Dr. Sober and Perigo and others across our ecosystem.
Yeah, I can add to that. First, I have to say I am a huge fan of the Thanks Birth Control campaign and have been for many years. So it's always a fun highlight to look forward to. So I encourage folks to check that out. And, I think going along with, what I was mentioning before regarding, some of the challenges in raising awareness. And I think, that in today's world we need different strategies to engage different folks, and we have to sort of find folks, and meet them where they're at and where they're getting their information from. So just like Dr. Reagan said, she never expected to be a TikTok star. I think that's where a lot of folks are getting their information these days. We're going to college campuses to talk with students and folks, for whom that's their main source of information, and really just trying to find, different points of engagement, since I think there's no one size fits all for getting folks involved and raising awareness.
Let's look ahead. What developments in contraception or reproductive health are you most excited about right now?
Yeah, so much has changed in the almost 20 years since I've been practicing. Um, and there's still so much on the horizon that excites me. Having oat pill come to market a year ago was amazing. There is also a combined pill working its way through the over the counter switch, and hopefully that will come to fruition and be another option for the future. I'm really excited to see the focus on pain management, particularly around IUD insertions. I think that's something that's been super neglected and a contraceptive practice that is long overdue to come into play for everyone.
Yeah, I would agree with pretty much all of the things that Dr. Reagan just mentioned. And I think for me, really anything that's going to meaningfully increase access to contraception for any segment of the population is incredibly exciting. And, a lot of those things that Dr. Reagan mentioned will do so. I think, the telehealth component is important, as well on the contraceptive side, to give folks who do want to interface, with a provider in some way, that ability, even if they don't have a provider close to them. And then, as Dr. Reagan mentioned, there is a company working on trying to bring a combined oral contraceptive over the counter, which would provide another option to folks OTC. And, as clinicians, we really know that the more options that folks have available to them, the more likely they'll be able to find one that works for them. So I think, the more the better. And I'm excited for all of these things coming down the pike.
Well, it sounds like we certainly have a lot of challenges on our plate in the space of contraception, reproductive health, but that the landscape is expanding to offer more person centered contraception options. So that is certainly reassuring. As we close out, I'd love to hear a few words of wisdom from each one of you. What advice would you give to the next generation of leaders who are eager to make a difference in the space of women's health?
My advice would just be to say that persistence is really key. So, I would urge folks to kind of stick with their goals and keep going, even when it's difficult and seems as though it's an uphill climb, because let's face it, I think that's our baseline these days.
Yeah, I mean, I can't imagine being someone starting a career in medicine right now and thinking about focusing in on reproductive health. They might say, you know what, I want to choose a less challenging field. But I would just say now is the opportunity. Right now is the time to really say yes to impact, and finding a way forward to make things better for the next generation. Try to find the intersection of your passion and your skill set. I've been really lucky to find that. And remember that your first job might not be your forever job. That was advice that someone gave me, and it's so hard after you like put so much time and effort into your training, and you feel like you have to land on like the perfect job with your first job. But more than likely your first job's not going to be for your forever job. But jump into it, learn some things, learn about what you don't like. You often can learn more from about what you don't like and from your failures than from your successes. And from there, just keep showing up and saying yes to impact and working with really, really cool people, and you'll never know where it will lead you.
Thank you both for such an inspiring and insightful conversation. Again, your leadership, your advocacy are powerful reminders of what's possible when we can work together to champion access and equity in the space of women's healthcare. So, thank you to our listeners as well for joining us, and stay tuned for more conversations at the crossroads of care, innovation, and impact on Hear from Her. Thank you.
Thank you so much for having us.
Thank you.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear from Her is brought to you by Medscape Education. Please subscribe to Hear from Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.